Hello, I'm Christina Mengurian, Vice Dean for Faculty and Academic Affairs in the UCSF School of Medicine. In this role, I'm responsible for overseeing areas that impact all of us: appointments, advancement and promotion, faculty development, outside professional activities, and compensation. Our office is here for you if you have questions, so please don't hesitate to reach out. In this video, I will summarize key School of Medicine-wide features of the Health Sciences Compensation Plan, or the plan. Specifically, a few things that are really important for many of us: compensation, rules around outside professional activities, and general benefits, including leaves. You can also review all of this content on the Compensation Plan's Essentials document that's available to you on Box, where you can also find your department or ORU's plan, the departmental plan. It's important that you review your specific department plan and should discuss specific questions with your chair, director, or chief administrative officer, or CAO. Now remember, this summary that we have online does not address all aspects of the plan, and in the event of any discrepancy between the summary and the plan, the terms of and conditions of the plan govern. Please note that when I refer to faculty in this presentation, I'm only referring to faculty who are members of the Health Sciences Compensation Plan. Sometimes you may also hear the term plan participants used to describe this group of faculty. So first, I'm going to discuss compensation. Compensation is set annually for the fiscal year, effective July 1st. Each department determines the factors it uses to set salaries, and those factors vary by department. There are four core components of compensation in the plan: base salary, your X and X prime; negotiated compensation, or Y; incentive compensation, the Z; and administrative stipends. So the base salary, the X and the X prime, is based on faculty rank, step, and department or ORU academic programmatic unit, or APU. This is also described as a scale. Your base salary increases as a faculty member advances in rank and step. It is the only salary component that is covered under the University of California retirement. Now, X is the Health Sciences Compensation Plan Scale 0 by rank and step. The X prime is the salary differential between the X and the department APU scale, again, which is set by the Office of the President for all UC campuses. All faculty receive a base salary, that X and X prime, and may be eligible for negotiated compensation, administrative stipends, and/or incentive compensation. Negotiated compensation, the Y, is in addition to the base compensation and is determined annually by each department chair or ORU director. Incentive compensation, Z, may be offered and is based on a number of criteria, which may include clinical effort or other activities that generate funds in excess of those required to cover the base and negotiated compensation. Administrative stipends may be offered to faculty who hold administrative and/or leadership responsibilities. The specific methods used to determine X prime, Y, and Z are set by the departments and are described in each plan. Now I'll discuss outside professional activities. Faculty owe their primary professional obligations to the University of California. The university recognizes the benefit of faculty engagement in outside professional activities, and different rules and requirements apply depending on the type of activities and the extent to which these activities creates a potential conflict of commitment with the faculty members' UCSF roles and responsibilities. Now, plan participants are not permitted to perform any clinical work, including but not limited to direct patient care, outside of the university setting, except as part of an approved affiliation agreement, for example, at Zuckerberg San Francisco General or the San Francisco VA, or an executed professional service agreement between UCSF and an outside clinical entity. This prohibition is applicable at all times, including when the faculty member is on vacation and/or other paid or unpaid leaves. There are several types of allowable outside professional activities. Category 1 activities have the highest risk of conflict of commitment because they are related to the plan participant's qualification for UCSF appointment, but performed outside of UCSF and/or require significant time. Category 1 outside professional activities include founding a company, assuming an executive or management position, any employment outside of the university, teaching or conducting research outside of the university, acceptance of an honorary visiting adjunct or other appointment in an outside institution, whether paid or unpaid, and/or participation in or application to talent recruitment programs. So these are specifically designed to recruit science and technology professionals or students, sponsored by a non-US government agency. Faculty who engage in Category 1 outside professional activities must use the OATS system to obtain prior approval. In general, approval for Category 1 activities lasts 1 fiscal year and must be renewed. Category 2 activities generally have a lesser time commitment and therefore have lesser potential for conflict of commitment than Category 1 activities. Examples of Category 2 activities are outside consulting work, expert witness testimony, and/or serving on a board of directors or scientific advisory board. Category 3 activities are considered within the course and scope of university employment and have a low risk of conflict of commitment. Examples of Category 3 activities include serving on an editorial board, giving professional presentations, service on a federally sponsored grant review committee, and/or reviewing manuscripts. If you have a question about what constitutes clinical work or what is the appropriate categorization of your outside professional activity, please contact your department administrator, chief administrative officer, CAO, or our department. When engaging in outside professional activities, there are other important policies you need to be in compliance with, such as the patent policy, the conflict of interest policy, and the industry relations policy. Now, I'll discuss how to report any of these outside professional activities. All faculty must complete an annual disclosure, this is called a certification, in OATS, whether or not they engage in outside professional activities. The deadline for submitting these is September 30th every year. In addition to annual reporting, there are requirements that apply to cash and non-cash compensation. Cash compensation for outside professional activities must be disclosed annually in OATS. Non-cash compensation related to a Category 1 activity, like stock options, or founder shares, must be disclosed to the dean's office, ideally in OATS, within 30 days of receipt. Questions about OATS should be directed to your department or ORU administrator. Now I'm going to discuss general benefits. Faculty are eligible to receive a number of benefits, as may be approved by the regents, including the UC Retirement Plan, participation, healthcare and disability benefits, and regular term life coverage. There are additional optional disability and life insurance benefits. Now I'll discuss leave that you are entitled to, starting with paid leave. UCSF ensures that each department ORU provides minimum leaves required under policy within their plan. Departments have the discretion to modify their compensation plans to offer more than the minimum for certain types of leaves, and many do. Following are the paid leave benefits common to all UCSF compensation plans, but consult your departmental plan for details. Extended illness leave is for faculty who are unable to work due to personal illness, injury, or disability. They are eligible for at least 6 weeks of consecutive or intermittent medical leave with pay. So that's X and X prime. To request extended illness leave, you should complete a leave of absence form and submit it to the department for approval. This is the minimum benefit for the School of Medicine. Please refer to your departmental plan to see your specific benefits. All faculty are eligible for the following paid leaves. Paid family care and bonding, PFCB leave, up to 8 weeks per calendar year with 100% pay, X and X prime. This is income replacement for up to 8 work weeks per calendar year to replace the income that you would otherwise lose during an approved family and medical leave taken for a qualifying reason. Childbearing, 12 weeks of leave with pay, X, X prime, and Y, excluding clinical incentives and bonuses. Childbearing leave covers the time you are temporarily disabled because of pregnancy, childbirth, or related medical conditions. Child rearing parental leave provides non-birth parents with 12 weeks of leave with pay, X plus X prime plus Y. Again, excluding clinical incentives and bonuses within 12 months after birth, adoption, or placement of a child. Other paid leave or caregiving leave. Each faculty receives 5 days of leave with pay, X plus X prime plus Y, per fiscal year to care for an ill spouse, domestic partner, child, or parent. Bereavement leave. You have up to 10 business days, continuous or intermittent, paid leave, X plus X prime plus Y per occurrence. Vacation leave. Each faculty accrues at the rate of 2 days per month for full-time service. Sabbatical leave. Only latter-rank faculty are eligible for sabbatical leave. It's called academic leave in advance, and it's generally paid at covered compensation rate, or X and X. Professional development leave. Non-latter-rank faculty may apply for professional development leave, also called academic leave in advance. Professional development leave typically are approved for no more than 6 months at a time and are based on financial feasibility. Questions should be directed to your academic generalist. Other. Faculty are also eligible to request leave of absence for good cause, like military service. Now I'll discuss leave without pay and modification of duties. Leaves of absence without pay for other good cause may be granted, subject to approval by the chair, vice dean for faculty and academic affairs, and vice provost for faculty and academic affairs. These leaves are typically no longer than 1 year. All compensation plan requirements, including reporting outside professional activities, apply. First, there's child rearing parental leave without pay, which is available for up to 12 months. Then there's active service modified duties, which faculty appointed at 100% effort for at least 12 months who have a child younger than 18 years may request a period of active service modified duties at negotiated compensation, meaning the X, X prime, and Y. Active service modified duties is not a leave nor a reduction of effort, but rather a modification of your duties and expectations. There are many steps that you need to take within your department or division before submitting a request. Active service modified duties requires approval from your chair, the School of Medicine Vice Dean for Faculty and Academic Affairs, and the Vice Provost for Faculty and Academic Affairs. It's important to note that faculty remain subject to all compensation plan requirements, including those related to outside professional activities and the prohibition of outside clinical activities while on paid or unpaid leave. Faculty are responsible for consulting with HR to determine how a leave may or may not impact their benefits and academic advancement. I hope this video has helped you better understand how your salary is determined, your responsibilities for reporting outside professional activities, and the leave you are entitled to as a member of the Health Sciences Compensation Plan. I strongly believe that only through building trust and transparent communication can we ensure equity and academic excellence. Again, our main goal is to make sure that all of our faculty thrive here at UCSF. We are proud to serve our extraordinary and diverse body of faculty, united in our shared mission and values. Thank you.